One thing I've noticed with cancer, and I've had to go through this with my dad, talking to his oncologist and other things. He had, metastatic prostate cancer. I was counting 18 tumors in one lung. Uh, is
Mm,
when you mention any sort of metabolic therapy, they really just eyes glaze over, and then you talk to them about this around this and other patients, and their response is sort of like, "Oh, yeah, I don't really get it. It might not work." They'll say things to the patient like, "Just eat anything you want to make sure you keep your energy up," which is appalling advice so far as I'm concerned.
it
Or
is. It is. Yeah.
even if they do understand something about the mechanisms, they go, "Well, there's no point mentioning it because they won't do it," which in my mind is unethical to not mention the best possible treatments. We're certainly happy to mention, removing parts of the body and uh, blasting people with a potentially deadly poison and the state of chemotherapy and that sort of thing. Why do you think that happens? Why do you think people are unwilling to mention these therapies?
Okay, this is such a great question. And, I used to think the main reason we don't adopt fasting keto is because of financial reasons that, drug companies, it's hard for any company to make money out of fasting protocol. But I think that's number two reason. The number one reason goes back to what your question. So before I answer that question, what that number one reason is, basically, here's how we treat cancer at this point in time. We use surgery, chemotherapy, radiation therapy to kill the tumor cells. And they are very good at that. I think they are very good. And that's the idea of medicine as uh, attacking diseases. That's the model we base our current medical system on, pretty much for all diseases, disorders, I call them, rather than diseases. So you try to kill the cancer cells. Fasting keto make life difficult for cancer cells. They take away their main fuel source, which is glucose. They create a lot of ketones in the body, which maybe have some antagonistic effects against the tumor too. But the more important aspect of fasting keto, these metabolic strategies, is not their ability to kill tumors, in my opinion. It is the ability to promote health throughout the entire, in this case, glioblastoma, say, brain and body. So this, what they do is they make the normal cells go into stress resistant mode, protects them from the chemo and radiation themselves, which are damaging. The cancer cells cannot enter this stress resistant mode. They keep dividing. Why? They are cancer. That's what they do. And maybe they become more susceptible because their fuel supply is choked. Third thing, and this is where I take it further than pretty much anyone else, to my knowledge, I think what we have to do with cancer is not just heal the cells of around the tumor, kill the tumor, or heal the cells around the tumor, protect the normal cells around the tumor. We have to try and heal the cells in the whole organ or body. So you want to allow the mitochondria in different parts of the brain to undergo mitogenesis, mitophagy, and heal themselves up. Obviously, a person who's aged 45 who gets a glioblastoma multiform has a problem to begin with. There is some problem in their brain that resulted in this tumor. Someone who gets Alzheimer's has a problem, and you're just focusing on the tumor is not going to fix the greater problem. And hence, recurrences come in a year or 2 years later. We want to prevent the recurrences. So that's the whole thing. Now, why, when you pitch this, to answer your question, I'm getting there, to someone, first of all, they don't understand anything what I just said. So you have to explain the mechanism and the theory behind it very carefully and over. But more importantly than that, and you will understand this because I believe you have a background in psychology, is changing the number one problem with the why fasting keto are not involved in the medical system today is the dogma that pervades medical thinking. We believe that attacking diseases, whether it's Alzheimer's or cancer or atherosclerosis, attacking these weird little targets like LDL or genetic mutations or proteins in the brain is the way to try and cure this disease. And that is not what I believe now. I believe the way is to restore health. If you restore health, any perceived disease, which is basically a response to poor health, should, in many cases, fizzle away. Now, we know this happens in type 2 diabetes and metabolic syndrome, but can it happen in cancer, Alzheimer's? I don't know, maybe to a lesser extent. But most people in this medical system, even in medical students, believe that doctors are here to remove disease, and it's not the way. So if doctors believe this, it's very hard for patients to believe in a different strategy. You have to change the psychology of someone before you start these therapies You can't just say to someone who's been doing 3 meals a day, high processed carbs for their entire life, and they're 60 years old, start a 5 day fasting protocol every month, eat once a day, and make sure it's a ketogenic diet. You can't just do that without changing the psychology first. But if you can change the psychology, these people can do anything.